Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guests today are Jean Bauer and Deborah Burgess, but they're not really the guests because the guests are Shelby and Bella. Bella knows her name too, and we're here to talk about pet therapy today. So first of all four of you ladies, welcome to the show. We're going to start talking with Jean here. Jean, tell us about pet therapy. And by the way, thanks for coming back to the show because you were just on recently.
Yes, thank you. That was a lot of fun. Well, pet therapy has grown tremendously over the last several years, and the purpose is to have dogs comfort people, whether they're in a nursing home, whether it's after a trauma like the Sandy Hook shootings, or special needs children. It doesn't matter. The dogs have tremendous healing and comforting properties, and they make people happy.
They sure do. Even if it wasn't in a therapeutic situation, they make people happy. But how was it discovered way back when that dogs have this amazing ability, or animals, pets in general, have this amazing ability to make people feel better?
Well, in one of the books I read, and I'm not sure I'm 100% right, but there was a dog during World War II who really had an active pet therapy role before there was that phrase.
Yeah.
And then after World War II, it grew into a program. But really, I would say in the last 10 or 15 years, it's really grown tremendously, especially after 9/11, where dogs were so important for the first responders.
Yeah. Does it take a special kind of dog, special breed to be able to do pet therapy, or does it really not matter the breed? It just matters what the person's reaction is to them and vice versa, what kind of a bond is developed?
Well, it doesn't really matter on the breed. I mean, both Bella and Shelby are mixed breeds. They're both rescue dogs, and who knows what they're made of.
Yeah.
But there are temperaments that are easier.
Yeah.
So, for example, Shelby, being more lab than Bella, is very relaxed. She doesn't mind being patted on the head. She's good with everybody.
Mm-hmm.
And Deb and I do go to Apple Rehab together, so we get to see each other's dogs in action. Where Bella is a little bit more high-strung, being part terrier and part whippet, and maybe from her early upbringing on Dead Dog Beach in Puerto Rico, I don't know.
That's a horrible place.
It's a horrible place. She's a little bit more fearful, a little bit more tentative, but she passed the training, so, and they're both great at what they do.
What does it take to be a therapy dog? What kind of training is involved in that?
Well, really, I look at it as 3 stages. You start with obedience, because you have to have a dog who's going to sit, who's going to heel, who's going to do what you tell them to stay. And then there's Canine Good Citizen, which is a AKC, American Kennel Club, class and certifications, and that's like advanced obedience, wouldn't you say? And then from the test after that is the therapy dog test, and that's even more difficult, where they're really tested. For example, Bella, when she had her test, they ran into her, not hard, but they ran into her with a walker, with crutches, with a wheelchair.
Because those are the things that are going to happen, you know, perhaps in a convalescent home or any facility like that.
That's right.
Where rehab is taking place, and you're going to, there'll be walkers around, and sometimes someone's going to bump into somebody, right?
Exactly. So they want to find out what is that dog's startle reflex. So that's a hard test with lots of pieces to it, but that's one piece that takes some work to get ready for.
And every dog has its own unique personality too, doesn't
Yes.
it? Like Bella was a little bit skittish when she came in with me, but then as we saw a few minutes ago, she plopped down and was accepting the pets just like you wouldn't believe too.
Yeah.
So get a little comfortable with you, and then she's fine. Yeah.
Yeah, it just depends. I mean, in the hospital, I have a really hard time with her when nurses come running. Oh, it's a dog, it's a dog. And then
Bella's might be a little skittish.
she backs up.
Right.
Where Shelby would be like, yep, that's right.
Bring
I'm
it
here.
on. Bring it on, right?
Yeah.
Now, when they go in and they do their service, let me back up and talk about the facilities that allow the pets in to be pet therapy dogs. What is their reaction? What kind of a process do you have to go through with them initially?
Well, it's quite complicated.
Is it really?
It is.
Yeah.
I mean, Bella has been a therapy dog a little over 3 years, and we were living in Pennsylvania there, and it took me another 2 months to get into the hospital. It was really a lot of paperwork. And
were they resistant to it?
No.
Or was it just a lot of red tape that's involved just to make sure?
You have to have 2 TB tests, and
Okay.
you have to have a background check, and you have to have a...
They are a hospital. There is some safety issues that I
Yes.
think they have to adhere to,
Sorry.
right?
Sorry.
So yeah, just relax, just roll over. That's all, right?
Woof, woof.
Yeah. So so it's not necessarily easy, but these are all steps that are necessary and required, right?
Yeah, and things have changed a lot. Like the hospital where Bella started, St. Mary's in Bucks County, Pennsylvania, the fellow who started the program about 12 years ago now, he had had a heart attack, and his wife brought his dog in, and he saw what a powerful effect his dog had on the other patients. But when he started that program, he was only allowed in waiting rooms. And by the time Bella got there, we went everywhere except surgery and maternity.
Right, where everyone's wearing, I would imagine if you're wearing a mask that you probably can't bring the therapy dog into those areas too.
Yeah, we have to watch even in the nursing home where Deb and I go, there's signs on the door, and if it says precautions, then we can't go in.
Because I would imagine, as much as I love dogs more than anything in the world, but some shed, and there are hair particles that can get out. Not necessarily the most sanitary environment when you're in a hospital setting, right?
Yeah, although it's interesting. I mean, diseases don't really pass dog to person.
Right.
So, but there are instances where, for example, there was a patient who had a very low blood count, and so we weren't supposed to go into her room because we could be carrying things and she could be
Exposed.
And then there was one patient who both Deb and I got very fond of, who had an infection that could have traveled to the dogs, or that the dogs could have spread to somebody else, so we couldn't go in her room.
By the way, in case you're wondering, Deborah is not mic'd up right now, but we will talk to her in the second segment. So, by the way, I'm experiencing some therapy right now, just petting Bella.
Oh, yes.
She agrees.
Yeah.
Just, it's amazing therapy. Just petting a dog. I think I know this for a fact. It lowers your blood pressure.
It does.
It relaxes you, and I'm sure it feels good for the dog too, right?
Yes.
And Bella has warmed up to me quite a bit.
Yes, she
and
has.
Shelby, just that tail has not stopped wagging the whole time that we've been doing this TV show. So what's the story, Shelby? You having a good time? We're going to eventually have to turn you around so that the camera will see you, but we can do that in the second segment. So, now, is there a name for the pet therapy organization that you work with specifically?
Yes.
Oh, we're getting treats now.
yeah.
We're getting treats.
Well, both Bella and Shelby are certified by two different certifications.
Oh.
So Shelby is Pet Partners, and which used to be called Delta, and Bella is Bright and Beautiful, which is out of Pennsylvania.
Okay. And when they go in and they do their therapy, do they wear their vests when they go into hospitals or convalescent homes and things of that sort? No, you just go. They can just go right in.
They wear badges like what Deb
Oh,
has.
okay. They have
and I'll put my badge on for the second half.
All right.
But one of the understanding I have as to why they don't wear vests is you want the whole dog. You want the people
to be able to pet them.
Pet the whole dog.
That's a good point. I wouldn't want Bella to have. I want to be able to pet her, not have the vest
Something
on.
in the way. Yeah. So we wear the badge, and that also insures us in case anything happens.
Describe, if you can, the reaction, the look on a patient's face when now they probably know the dog is coming, right?
No.
Or is it a surprise?
No,
Is
it's
it total
usually a surprise.
All right.
Don't you think?
Yeah.
On Wednesdays.
Yeah.
Well, we'll get your mic on in the second half. Don't worry. So it's a surprise, and do you see their face light up? And
Oh, yeah.
and tell me about these gals. Will they jump up on the bed, or will they?
Bella does.
Bella, you get on the bed, Bella.
She loves to go up on the bed. Let me see if I can get her to do this. Come here, Bella.
Okay.
Come here. Come here.
Now, this is a little demonstration going
Pause
on
up.
here.
Pause
She-
up. Pause up. Yeah, that's a girl.
Oh, so she'll go up on the bed that way?
Yeah, well, she'll go up on the chair or up on a bed or up on the edge of a wheelchair.
Are they allowed on the bed?
They are allowed
Okay.
on the bed. In fact, when she was
Shelby gets on that bed? Yeah? Yeah. I don't know
that's
about
a
that.
dream, but no,
Yeah.
Shelby doesn't because Shelby's bigger.
Shelby will walk up and down the stairs a few more times, and then maybe she can get up on the bed, right?
I don't think so.
No?
But Shelby's wonderful at just parking herself near people and letting people
Right.
touch
Just
her.
like on this show, right?
She's great.
Yeah.
She's really great, and she just gives a lot to it. Where Bella's a little bit more skittish.
Is there a time when
Come on, there. Come here.
it's time for
Sit.
a pet therapy dog to retire? And do you know when that time is?
Well, this is my first, and this is Deb's first, so we don't even want to think about that.
Right.
But I would think if the dog has health issues
Right.
or
Has trouble walking?
yeah,
Yeah.
then they would have to stop.
or if their temperament changed a little bit, that wasn't necessarily conducive to
Yeah.
being with people with patience and that sort of way. But for now, these are just some loving dogs that
Yeah.
just want to. Do they know? You think they know they're helping people?
I do. I
Yeah.
do. In fact, Bella knows the word work, and I say, "Do you want to go to work?" And she comes around, and she knows there's always lots of treats involved in work. Come here, Bella. And
How many of those treats you keep in that pocket there?
quite a few.
Yeah.
They're very small, though, so
Yeah.
and we have to be fair. Shelby
So
will
every
get,
time one gets one, you have to make sure the other one. Otherwise, there are issues. You know.
there aren't issues, but
No.
we're just that's just the way we
You're
do it.
fair and impartial people, right? So now, what is their schedule like as far as how often they go and do the visits?
They have quite a working schedule, these girls.
Little 9 to 5, right there. Yeah.
Most therapy dog visits are an hour to an hour and a half. You don't want a dog there longer. It's just and our primary responsibility as their handler is to make sure they're safe and make sure they're happy. So, for example, there's one child who I see at Dean's Mill School, at the elementary school in Stonington, who likes to kick. So I have to be very careful with Bella because it's my job to make sure she's safe and she
Right.
doesn't get kicked.
Is it one handler per dog? Is that how it works?
Yes.
Okay.
So therapy dogs are trained by their handler and the person they live with. When I started training Bella, my husband wanted to do it with me, and the trainer made it very clear that there could only be one.
So that the dog gets attached to that
Yeah,
person.
it's
Well,
too-
what about when you're at home? Does the dog?
Oh, yeah, she's crazy about my husband. Yeah.
Oh, she does. Okay.
Oh,
so
yeah.
so she'll plop up on the couch and
Oh,
everything
yeah.
too.
Yeah.
But when it's work related,
It's just one person.
you and him.
Yeah.
But does he also do it?
No.
Okay.
No, I mean, the theory is, and I don't know enough to tell you if it's right or not, but just that if you changed handlers, it would be confusing to the dog. It would be different signals, even if it's someone they live with.
That's a very good point. And no point rocking the boat if things are working out the way they are, right?
Yeah, so they know. The dogs know. I mean, this leash, Bella, we only use for working. So she sees this leash, she knows.
She knows that it's
Yeah.
for work
Yeah.
and not necessarily. Do you call this TV show work? This is fun stuff.
This is work.
Is it work for you or for Bella and Shelby?
Well, it's like work.
Yeah?
It's like work.
So what's going to happen with these guys what happens the rest of today with them?
Oh, we'll go home,
Mm-hmm.
and then she'll have a nap, and then she'll have a good walk, and then she'll have dinner, and then she'll get on the couch and watch TV. And,
It's kind of couch
life-
potato
and
then,
life
huh?
is good.
No wonder Shelby's.
and then
you
she'll
know-
chase the cat, and
Oh,
then...
well, so that's where it gets her exercise from then,
Oh,
right?
no, we walk over a mile every day, minimum.
If somebody wants to learn more about pet therapy, is there a website for them to go to or a number to call, or what can they do if they go
I would say in
online?
Connecticut it would be the Delta Partners and
Okay,
Pet
so-
Partners, excuse me.
Pet Partners.
Pet Partners.
All right. So-
and
so
Deb can talk more about that.
All right, and we'll put a graphic or a link to the website up on the screen. We'll take a break and come back with these 4 lovely ladies. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. We are chatting about pet therapy today, one of my favorite topics. For this segment, Deborah Burgess will don the microphone, and we still have Bella, we still have Shelby, and we try to get Shelby to kind of turn around and let everybody see her beautiful face, but she just wants to look at Deborah, obviously because that's where the snacks are located. So Deborah, tell me a little bit about yourself and also the organization too.
Well, Pet Partners was Delta Society. And a
What
few
was the
years-
change for?
I'm not really sure why they changed it. Right after we first tested into the Delta Society, within a month, suddenly there was a name change. And it's a really great organization. They're very strict.
What does that mean, though, as far as who they allow in?
Well, the testing is
Okay.
very strict, and you are retested every 2 years.
Okay, so it's a refresher kind of a thing.
You have to be tested. Has been now tested twice.
How much does the handler, the owner, have to learn too?
A lot.
Yeah, is
A
that
lot.
right?
We
You're studying?
spent 3 months at school, going once a week and learning how to handle her, what to do in a situation at a nursing home or a hospital. We also took one extra course called Pause to Read, where we've been to the libraries and children come in and sit and read with the dog, and they love that. And she sits and listens to them read, and then if I speak to her, Shelby, how's everything? Nope, she won't do it, of course. But usually when they finish a story, I can say, "Do you like that, Shelby?" And she'll wag her tail.
Well, she hasn't stopped wagging
Well,
her
she
except for
did right now, of
Yeah,
course, because I
yeah.
want her to. And it's funny because I'll say to the child, "Look, she loved your story," because her tail will wag whenever we speak to her, and they just love it. Children that are lacking confidence in reading will read to a dog because she is not going to correct them.
And she'll sit there and just look at them and listen, hoping maybe that a treat will come at some point, but also...
Yes, at
Yeah.
the end she gets a
Isn't that
treat.
one of the greatest things about a dog? It's the unconditional love. It's the non-judgmental, and that's why I think people like them. And in this case, like you were talking about, the kid reading knows that there's not going to be any negative feedback, regardless of how they're reading or miss a word or anything like that.
Right, and I don't interfere unless they look at me and ask me what the word is. I just sort of leave her with the child, and it's great to watch. And you can see the progress. Jean does this with Bella, and you can watch the progress in a child from the first day that you go in, and then a month or two into it, and they'll run and see her coming and grab onto her and read, and
Do they get attached? Do the kids get
oh
attached?
yes,
Is that right?
Oh yes.
Yeah, I mean, it's a natural bonding process that I imagine. It must, at some point, you have to go, just so you know, she's mine.
She's mine.
Right.
Right.
She can visit as often as you want, but she's still coming home, right?
Right,
Yeah.
right.
Does she have a reaction to certain, does she remember them? And
Oh, yeah.
Yeah?
Oh, she'll see them. And one school that we were going to, we've since moved, but last year when we were going to a school, we would get there right after recess. And we would go in, sign in the office, and as we were going over to the room, the bell would every week inevitably ring as we were trying to make our way to the room, and hundreds of children would come in, and the children that were going to work with her would run down, slide on the floor, and grab onto her, and all the other hundreds would get around her.
And what is her reaction?
Wagging her tail.
Oh, it doesn't matter how many, huh?
Doesn't matter with her. She really does not get upset about anything.
Just a great temperament on
Very,
her
very
too.
sweet.
Now, in the first segment, we talked with Jean about the bit of a rigorous process, like with hospitals, going through the red tape. How about with schools? What's that like?
That was much more difficult for Jean. She to cut the tape to get in there. Once you get in, I think we could work every day.
Is that right?
Once we got in there and they heard about the dogs, you get so many requests and you have to kind of turn them down.
Well, how do you do that? How do you decide what is enough throughout the course of a day? How many kids in one
Well, I work
sitting or setting?
part-time,
Yeah,
so whether I
right.
can fit it in. And then my organization does not want her working more than 2 hours at a time.
Okay.
Really prefer less
It's the
than
union
that.
rules, right?
It's the
Yeah,
union,
she's in
right,
the union,
exactly.
yeah.
She's in the union. Well, it's for the dog, too. She gets tired.
Yeah.
If we're at Apple on Wednesdays, about the last wing, she's sort of had it.
Yeah.
You know, she'll-
How many kids at one point can be with her?
Well, she usually, that's one-on-one with
Okay.
the reading.
Right.
But she doesn't mind a crowd.
No,
She
they're
loves it.
just observing
Yeah.
and everything like that. What do you do during, like, as we tape this, a lot of bad weather? What happens in those situations?
Well, we just stay home, and
Yeah.
she is having cabin fever big time.
Is that right? Yeah.
Yeah, I have
'Cause
3
dogs love to go
animals.
out and play in the snow too. So
She's not big on the snow. She came from Tennessee.
okay,
She's a Tennessee girl.
she's a heat likes the heat.
She
the
likes
South.
the heat. She likes the heat. But
A little
yeah,
bit more.
she's
What
great.
should people? Let's talk about the organization a little bit more. What should people know about it? Can they learn more if they want to maybe get involved in some capacity? What can they learn from
They
it?
should go on the webpage for Pet Partners. It's a national organization. They can give you all sorts of information. Recently, they've now are allowing, from what I understand, home testing, not home testing, but home, you can get a booklet and you can try to teach yourselves at home, because people that live in rural areas can't get to schools that can be.
When you
that
say
can get
teach
to schools.
yourself, you mean teach what the
From
dog
book,
needs to
from
do, or
both of us,
you as the
both of
human
us.
need to do?
They have a big old book,
Yeah.
and it will tell you what she should do, how she should behave.
Really?
As I can tell.
Is that your opinion of this show? Is
She's
that what's
just
going on?
so
Oh, the tail
laid
wags
back.
at least, yeah.
The tail. She's
Yeah.
so laid back, and it is. The test is really, and it's a great test. I find it's very. They really want to go for the temperament. It's not, there goes her tail. It's not so much how many tricks she knows. It's just the temperament. The person testing, like Jean said, they kind of bump into them with things. They throw things down for startle. You have to be able to walk up to the person testing with. They have a dog that she's never met, and I have to be able to walk up and shake hands with that person, and she cannot react to the person. The tester has to be able to bear hug her, and actually go at her like this, which she wags her tail when you do that.
No matter what you do,
She doesn't
the
care
tail's
what
wagging.
you do. Right.
Well, I think she's also eyeballing you for a treat too.
Well, she's looking at
Yeah.
Jade. She just,
No, this is love.
it's love.
That's all. You don't have a microphone on, but
It's hard
we
when you
can,
don't have a
you know,
microphone.
but it's love. That's all it is love, right? She's with you guys all the time. So that, do you ever get is there ever a situation where there just isn't chemistry, maybe between a dog and whoever they're there to visit? Does that ever happen?
No.
No?
I mean,
How can you?
She might be more attracted to someone than others, but she'll usually go to just about every person.
Can they sense, you know, what a person's?
She can sense when someone isn't feeling well.
Is that right? Really?
Just
well, how will
recently we
her
had that happen.
disposition change if that's the case?
Well, if she just might not wag her tail and go up to someone if she's not
Okay.
as into them. But when we've just recently had some people that have passed away or been very sick, and she has known.
Senses it.
Oh, yeah.
I'm sure animals have a sense that's beyond our ability to know if something's going to happen like
She
that.
tried
Yeah.
desperately to pull us into a woman's room that we couldn't visit. And the woman died the next week, and she tried everything
knew, huh?
to get me to bring her into that room.
Wow.
Yeah, it's quite amazing how they can figure things out. We also went down to a local school where there was a tragedy earlier last year, and we went down to that school and walked the halls of the school so that children, the high school children, could come out and see the dogs. There were maybe 6 or 8 dogs walking the school, and they would come out. We would just sit on the floor in the hall, and they would sit around with her and just touch her and talk to her, and it helped them.
They allowed to if you could tell that they're not feeling good on a particular day, because everybody has days where they don't feel good. Do they get the day off?
Oh, yes.
Yeah.
Oh, yes. She's had days. She's actually a cancer survivor.
Is that right? Really? Wow. Wow.
She had cancer.
She's a rescue dog, a cancer survivor, a
survivor.
therapy dog. That's quite the life. That's a full life too, huh?
Yeah, and she's a very happy dog. She had cancer surgery a year ago, December, and she's doing beautifully.
Ever she been a mother ever? Or
I don't know.
No,
'Cause
okay.
When I
good.
rescued her or adopted her, she was 3.5, 4.5. We're not sure. We know nothing about her first part of her life. She was in a high kill shelter in Tennessee, had been abandoned. So we know nothing about her.
Well, her life has changed for the better, for sure.
Oh,
right?
yeah, she sleeps on leather furniture every night. Tough life.
Watches TV.
Oh, yeah.
So if somebody's watching the show and they want to either get involved in some way, whether it be volunteer or maybe learn or maybe see what they can do as far as starting out with a therapy dog, where do they start? What's the best thing?
They should start by looking on the website at Pet Partners, or there might be some other organizations that I'm not familiar with. There are groups in the area that have classes for pet therapy. I actually went through Middletown Adult Education, which was in Old Saybrook Adult Education. There are dog training areas that can also help you, and then you have to find a tester, someone that can test them.
And the way it works is the dog and the owner are it's your dog.
We're a team.
Right, you're a team. So it's not like you're just using a dog from a facility or organization and then you are the handler. It doesn't work that
No,
way.
we are a team.
The pet therapy is with your dog, and you decide where to go and how often, as long as you follow the guidelines that.
We are a registered team, and the organization actually has an insurance policy, but you have to abide by their rules, and which we do.
Does that include things like vet visits and things of that sort?
Oh,
or
no.
health, nothing
No,
like that?
we take care of our own dogs.
Oh yeah.
Oh, yes.
Yeah, and vet health probably isn't necessarily inexpensive.
Not at all.
They do have pet insurance, but I really don't know too much about it or whether it's really worth it or any good
I
or
haven't
anything.
researched it yet. I probably should have before the cancer surgery, which was
Right.
not cheap.
Yeah, yeah. It's not cheap for humans, and it's not cheap for dogs either. That's for sure. All right. Well, let's take one more break and come right back. I'm Sean Murphy. This is For the Record. Stay right there. So that is our show for today, but I do have a treat in hand. I'm going to see if I can get at least Shelby. Shelby, want a treat?
Shelby, cookie.
Want a treat? Cookie?
Cookie.
Want a cookie? And the tail wag. Can I give one? How can I give one to Bella? Bella? Bella, you want a treat? Bella, look, treat. Here you go, Bella.
See, Shelby tries to take it.
You're slick. Bella didn't want to take it. She's a little
sneaky one.
skittish.
Okay, you little piggy wiggy.
All right, there you go, Bella. There you go. Website one more time for people to go and see.
www.petpartners.org.
Gene
Wonderful.
Bauer, Deborah Burgess. You were going to say one word, right?
Wonderful.
All one word.
I highly recommend looking into pet therapy. It's a great thing to do.
Shelby, Bella, thank you for being on the show today, too. Very much appreciate it. You can see this show and many others on our YouTube site. I'm Sean Murphy. Till next time, we will see you. Take care.